Morning, everyone, and thank you so much for joining the webinar. So 2020 has been a little bit of a different year, I would say. And so we needed to talk about how to adjust our plans now, urgently, and sort of how things have changed since COVID rocked our world, and also for things that are here to stay as a result of COVID, so longer term plans. So just so we're on the same page, Paul, why don't you move forward? We're here to discuss our top trends, top 10 trends. And the intent is sort of to just give you, have it serve as a possible guide. And so there's like a framework for you to think about things as you move forward. So as Paul said, and for some of you who have just signed in a little bit later, we do have the Q&A box down below open if you want to put some questions in there. And there's also the chat section. Feel free to use that at any time. And please, please interrupt us at any time. I'll be monitoring all those questions, and I love interrupting Paul, so that'll be great. Next slide. So introductions, I'm Sharon Lawless, and as some of you maybe know, we officially earlier this month announced that the official merger of Smith & Jones and Overit. Smith & Jones has been helping hospitals and health systems with branding and service line marketing for over 30 years. The merger with Overit, as you I'm sure know, has brought 45 smart and super talented folks from every facet of marketing and production, including video and audio visual, content strategy, digital marketing strategy, etc. Basically, we now do everything collectively with the exception of printing and call centers. So that's a win-win. The authors for today's presentation, Lisa Barone, who is our Chief Marketing Officer, an 8-year veteran at Overit, and she's also a content creator and leads our content team and guides strategy for most of our clients. Paul Fahey, as most of you know, without his bow tie this morning, is our VP of Strategy and Communications. Paul's worked with numerous healthcare organizations for many years, such as the Department of Health, Haney's, the CDC, just to name a few. There's Bassett and Guthrie and several others. So I'll turn the next slide over to Paul to talk about methodologies and the current situation.
Thanks, and thank you, Sharon, for the introduction. Good morning, everybody. Thank you to everyone joining us live this morning. As Sharon mentioned, please, as we're going through, if you have any questions related to what we're talking about, please drop those into the chat. As we move forward, each trend or what we're covering will be a little different than the previous, so we'd love to answer while things are relevant. So good morning, thank you. And for those of you that also signed up to watch this on demand, this was Thursday morning. So, and as Sharon mentioned, we were building on certainly a lot of changes in 2020. This report and what Lisa, Sharon, and I, our team had developed, really the culmination of a number of different methodologies. From the very beginning, back in March, once this started to hit, we didn't know how long it was going to last. Some people, myself included, on earlier webinars, were more optimistic about a V-shaped recovery. We started surveying and really doing a lot of listening. We've sent out a number of surveys to consumers throughout the Northeast in particular, most East Coast, really just to get a sense of what we can learn about how their consumer behaviors are changing, their response to COVID, their health and wellness. We've hosted a number of now online focus groups. We actually have a formal focus group facility at our shop that's been shelved for a little while. This report is also a result of a lot of one-on-one interviews we've conducted. People such as yourselves, I recognize some familiar names in the audience, some industry thought leaders, people like board chairs of hospitals, and even elected officials, particularly here in the Northeast, to get a sense of what they're hearing and seeing from their constituents. American Hospital Association continues to be a great resource for at least nationwide trends, and you'll see some of that woven through this morning. Social listening, I think you'll hear me say this a couple times this morning, I think social media is a dialogue medium, and it has as much value for learning and listening as it does for what we have to say and post. Lastly, if you don't use it, Google Trends is a free tool. Type in the keyword, look and see what's happening and watch trends, over time, just to get a sense of, what's happening in the public and how is the public feeling, what are they talking about, and certainly their online search habits. So as Sharon mentioned, let's first get a little bit on the same page. We've got a pretty diverse audience of folks joining us live this morning, and for those of you that are watching this on demand later. And again, we're putting a moment in time here. This is October 1st. There's a lot that's changed, seems daily. We're closer to a vaccine. The economy seems to be recovering. There's a little bit of concerns about that, waiting for that next shoe to drop, and we'll talk about that a little bit this morning. But and given the diversity of the audience, we have, small, medium, large institutions, urban, suburban, rural. We have folks, as I mentioned, from Denver on this webinar live this morning. We have folks from Florida and the Miami area, and a lot of us in the Northeast. And so I think it's just important for us to quickly get on the same page as we then move into the trends, and you'll see that we'll build on some of this. First, this was, and I'll talk about this later, this was your 9/11 moment. This was the public's chance to really see, especially in those hot spots, early on, New York, Miami, really see your people stepping up into something that now affected all of us. You have department level heroes, people who are saving lives every day, but they do it at the individual level, they do it at the family level, maybe at the community level. But this was a chance, I think, for the world to see, your heroic response to what was happening. And I think there's opportunities there. And while this is not my first economic downturn, I think it's my fifth. I started my career in the early 90s, enjoyed the dot-com bubble burst, 9/11, housing crisis, now this. This is, as Sharon mentioned, very unique and radically different than anything else we've seen. This is a self-imposed shutdown. We know why this happened. So, in the process, I think what was particularly unique for healthcare is that it hit us pretty hard. There were a lot of deferred and foregone procedures, and that, really puts a lot of pressure on organizations' finances. There were certainly disruptions of supply chains at the consumer level and even at the business level. Many of you had to adapt and embrace new technologies and equipment, and that's everything from health and safety to telemedicine. And all of that happening at the same time, we have this quarantined consumer that really changed radically. And we don't see, we see a lot of permanent changes. I don't think there are many attributes that we're going to go backward on, from consumer behavior. And I think of that in both the retail setting, but also in healthcare as well. We'll certainly talk about what we've learned. I think, in fact, that might even be our first bullet. So just really quickly, this is our 7th annual trends report. And within those challenges, the best we can offer is the marketing and PR and community relations perspective. We're not financial analysts. We're not, we are armchair economists, I suppose. But this is our team, our skill set, and where we've looked to help over the years. Throughout the presentation, we'll make a couple references, and you'll see this little green box, which has some actionable tips and takeaways, things that your organization can do no matter what size. We're trying to keep this very actionable, I guess, to repeat myself. We're not suggesting that you have deep budgets or teams of 20 people in order to take advantage of some of these trends and recommendations that we're making. So with that, I thought it would be helpful, for us to kind of get on the same page and then start to move forward now into the trends.
Yeah, so let's start with trends. Reminder for those who've signed on a little bit later on, please feel free to interrupt, because interrupting Paul is my favorite thing to do, and put your message in the chat, and we'll take care of that. So Paul, who is our new patient?
Yeah, and that was probably, I think, we started, and as we were organizing this report, thinking about the topics that might be of interest to most everyone, we thought really understanding how patients, and in particular their consumer behaviors, have changed would be, the first trend. Let's, talk about what we've heard and learned, the hows and whys of what they've gone through over the last 6 months and what they will go through in the coming months. patients and all of us really have gone through really a couple different phases of quarantine. You know, very early on, March, April, May, we were full on quarantine. We were, you know, doing Zoom Trivial Pursuit. You know, we were sliding meals under the door and really very much locked down. And quite obviously, when, you know, when you shut down an economy, you know, there's, you know, repercussions to that. And what was interesting, and I think what we learned early on, was consumers changed their media habits, and we'll talk about this a few slides from now. But in particular, they became much more demanding. They embraced technologies. They've embraced a very home delivery type of mode. And again, we'll talk about that a fair amount. They were stockpiling. They certainly stopped. And many of this much of this because of either state policies, but they basically stopped any elective procedures, and that, you know, hurt many of our institutions financially. They certainly had a chance to see you in action. I think there's a newfound respect, or deeper respect, than they already had for your profession. I think healthcare providers, any role within the institution, were always deeply respected. If you've seen these charts, unfortunately, you know, advertising practitioners are very low on that list, but healthcare has always been high, and I think much higher right now. As they went into semi-quarantine and now this new patient, they really emerged as advocates for their health. We saw a lot of people, you know, enjoying the outdoors more than they were from a recreational standpoint. They emerged with masks, and you know, they really became much more self-conscious about, you know, their role in healthcare. And it became a little politically polarizing on some levels. But I think for all of us, it was something where we at least had a sense that we had an individual role in our community's health. They have now new priorities in terms of their what's important to them in terms of health and wellness, in terms of shopping, and you know, now more empowered than they ever were before. I think what's interesting, you know, and one of the tips for marketers, you know, taking what I've said and what you've heard in your own communities and cities, and really pushing that back, letting, you know, letting people know that they've been heard. You know, are there ways that you can start listening on social media? You know, take advantage of that as a very free dialogue tool. How are you feeling? You know, remember the old Ed Koch, Mayor of New York City, how am I doing? You know, just to get a sense of whether you're meeting those needs. And one of the tips was either starting or perhaps restarting a patient advisory committee. I think that's something, if you can get a good cross-section of the public, people that represent every facet of your community, mirrors the community itself, at all levels, you know, faith leaders, community leaders, business leaders, you know, neighborhood representatives, you know, and even just individuals. You know, getting a sense and listening to them, I think, is very important, and even letting the community know that that group exists, so that you're there to meet the needs of new patients.
Yes, awesome. So next, I think, tell us what we have learned about staffing at healthcare organizations.
Yeah, and I think this is really, you know, very important. I think as we're talking about the changes in the public, you know, this taking your internal temperature, this theme and this trend really speaks to your employees. You know, that in-flight briefing when the you know, cabin attendants will tell you in the event of decompression, the mask will fall from above, oxygen will flow freely. Put yours on before you put on those of you know, your child. And the point of that being that, you know, if you put it on your child but you pass out, you're of no good to them. You really need to take care of yourself first, and then you can take care of others. And I think that's our point here is, you know, thinking about and taking the internal temperature of your employees. They've been through a lot, and in many communities really, really deeply hit. They were exhausted. You know, we had such degree of empathy for what they were going through. And now that we've gone through it and we've weathered it, there is a sense of, okay, we've survived that first wave and we kept our jobs. We are in essential industries. We're not worried about making our mortgage payments as much as other industries are, but we're worried about that next wave. And is the next wave going to happen at the same time we have our first wave of influenza, you know, as we come up on that season? So there's a bit of anxiety that's happening internally. And so, you know, again, like you're listening to the community, listen to your employees. Is there a lot of stress? Is there a lot of turnover? How can we make them feel valued and protected? What is it that we can offer them? Things like support groups, internally. Is that something that's needed within your institution? You'll know better than we would. Could you create meditation rooms or make sure that they're available if you already have them? There are a lot of apps that can be free, for employees. Even just letting them know about that in your e-newsletters and things, I think are very helpful. Anything you can do to show even a deeper level of not only that they're protected, that you're creating those policies, that they're valued, they're appreciated. One of our clients years ago started a dessert cart, just happened to show up in a couple different departments, at different shift times, just to recognize great work that they were doing, maybe an accreditation or a particularly, interesting milestone. And Army marches on its stomach. And I think that those things can go, quite a long way. And point being in the box there, how your team feels will, certainly carry through to how your patients are going to feel. And that's especially true in smaller communities. For my friends that are in the suburbs or rural community hospitals, very often you're the largest employer. Your neighbors taking care of neighbors, and that, internal morale, that internal mood and appreciation and stress will definitely carry faster than it might in some urban settings.
Thank you, Paul. So Paul, you mentioned that there's obviously been some financial hardships, especially for our friends at the hospitals and health systems. And they want to get those services clearly back up to speed. I'm sure there's still, much more room to go on that. Does brand matter now?
Yeah, and that's a great question, and what led us to this next trend. And it might even seem counterintuitive, as we want to get service lines back up to speed, if we want to start getting, the patients, scheduled in for procedures and start to capture lost or deferred revenue, it might even seem a little counterintuitive that you would or should invest in brand. There's an interesting opportunity here, I think, though. First, in my first bullet here, patients want to be loyal. My point there being, there was so much upheaval that happened, especially early on in the pandemic, that patients and people as consumers in general are very much off balance. Anecdotally, I had a moment where I was literally shopping for chicken breasts on my way home from work, and I stopped at the Price Chopper that I normally go to, and they were out. I was like, oh yeah, I've heard about this in the news, and there are some supply shortages. I went to 5 other stores. The reason I went to 5 other stores was purely based on supply and demand. I know my supermarket, I know the store layout, I like them, their prices are fine, and I just know how to get in and out. I have a relationship with them and I want to be loyal. But because of that, I'm very much off balance. And many of us in other areas of our lives, things that are even more meaningful than just shopping, we have, impact on our household revenue because of, the unemployment levels. And so they want to be loyal. They don't want to switch. You've already built the bonds that you have with your patients, with your community. And it's important to invest in that, because if you don't, somebody else eventually will start to, and you have an opportunity, to lose market share and some out-migration. So we think it's important. I wouldn't put 80% of our budget on that in the coming months, but don't forget to, consider messages at the brand level. Don't tell them what you do, show them why you do that. And I think in this case, profiling your people as heroes, your role as keeping your communities and neighborhoods healthy is very much, part of that core messaging. So where you can adapt the brand messaging to meet those new needs and fears, that not only are you, developing new safety and health protocols and policies, you have new technologies and PPE, but you're also listening. And your role at the very end of the day is just to keep your community healthy. And you want to know, because things are changing so rapidly, are we meeting your needs? And I think that basic, sort of brand level messaging would resonate very well. These are very brief messages. They're not necessarily deep stories. And while you might buy them on billboards or things externally, don't forget to post those internally as well. Many of you have TV systems, or even just, in hospital postering, just letting people know as they're moving in and out of your organization, about that. So, audit it, look at your current brand, and, ask yourself if it needs to be or could benefit from being adapted to these new sort of messages, speaking to the new needs and fears of your community, and then living that.
Okay. So how about talking about essential services? What do you recommend as the balance between essential services and brand?
Yeah, and I think, essential services, especially areas, things that were elective, that were deferred, are going to be important. You have to ring the register. You have to get your institutions' revenue back up. And I think keeping those services visible is really important. One of the lines from our trends report was, don't play hard to get. This is not the time to make it difficult for people to find you. And in fact, even having a very public reminder about those types of services. We have one client in particular that launched we're now open, for business, type of message. And this was something that, they felt ready to do back in July. There are a lot of gray areas. There are a lot of things that are changing, not particularly well-defined rules. Things are just fuzzy, I think, for consumers in general. And so the more you can draw that line in the sand, let them know that your essential services, whatever service line it is, bariatrics or orthopedics, whatever it could be, we're open for business, we're ready, and we're going to do it, safely based on new policies and technologies. So balancing that brand with service line, I think, is important. The brand message I described in the previous slide really helps you to maintain some of those bonds and truly, speak to and build, deeper relationships or retain relationships with your communities. But the service lines are critical. Make it easy for patients to reconnect. And in particular, from a tactical standpoint, we're recommending paid search, native advertising, social media. There's a lot changing in consumer media habits, and I'll talk about that in a couple slides. But one thing we do know is, if they're thinking about a particular service line, a symptom of something, I've heard this, I wonder if I have it. Paid search, I think, and in our little box in the inside, let intent lead the elective procedures. If I'm searching, I have an intent, I want to learn more about this. Make it easy for me to find you on my search engine, or in other places like social media, where, word can spread pretty fast. And so as a result, because you don't know necessarily the readiness of the public, it's part of the reason why we're recommending these digital tactics, and in particular search. Nobody's typing something in Google because they have nothing better to do. They really want to know about this. They want to learn about something. They're exploring symptoms. So they have an intent. And I think the more you can protect your budgets rather than, broadcasting as wide and far necessarily, depends on the service line and depends on your community. But I think in this case, search will be, one of the primary tactics.
Yeah. So something that we learned that's going to be really important now, and of course more so now, especially with the winter weather and potential second wave coming up. Can you talk about how mental health might impact healthcare organizations?
Yeah, this certainly has hit, and it's hit communities differently, different communities differently, but it's certainly something that I think has deservedly so gotten a lot more attention. I'm glad that people are talking about mental health more than they were, pre-COVID. A lot of it is in response to deeper community needs, certainly. I think it's hitting some communities harder than others, depending on not only what was happening with your community's shutdown or the economy, very much, I think, the economic impact. We sort of describe this whole situation as a healthcare crisis wrapped in an economic crisis, or maybe it's a economic crisis wrapped in a healthcare crisis. But while we're dealing with all of that, there are a number of different communities that are quite literally on fire. There's social unrest, and a lot of this is, just really stressing out, our communities. And as a result, I think because of not only what we're living through on a day-to-day basis, but also the uncertainty of what might be next. So there's no defined, end finish line for what's happening here. I'm very guilty of that, predicting a V-shaped recovery with us, kind of returning to most of our GDP by the third quarter. think now it's going to be the beginning of the second quarter, but you can quote me on that next year. You know, getting ready for it, I think anticipating it. This loss of normalcy, I think, is what's creating a lot of this anxiety and depression and you know, leading to higher instance of domestic violence and substance abuse. And to Sharon's point a moment ago, you know, as I think ahead to cabin fever, typically that's something that I suffer from late February. You know, upstate New York in the winter can be very charming, but at some point it gets just kind of frozen gray and dull. But because we've all been quarantined and semi-quarantined over the last 6 or 7 months, it's going to happen a lot sooner. And so those mental health services are going to be in greater demand. The more you can help and message and normalize it for your communities, you know, speak about it openly, make it easy for people to connect either through telemedicine or online support groups or having those kind of conversations, I think will be very important. But anticipate it, get ready now. Start drafting your social media posts, maybe building out a couple simple ads, you know, to promote those services. And, you know, anything you can offer to the community. Again, these don't need to be budget busting ideas, but the mobile apps that are available and even just having pages on your website with links to, you know, relaxation tips or articles or links to apps for meditation, or even just, I think there's an app that my bride loves called Breathe, you know, which literally reminds you to do that. Just pause for a moment and exhale. And certainly for communities that are dealing with mental health on the issues on the rise, you're already there, I think, in some cases, but I think a lot of us are going to be dealing with this in the coming weeks.
Sure. So we talked about the new patient a little bit. What opportunities are there? What opportunities does that present?
Yeah, so as I mentioned before, a lot of significant changes to how they did everything. They changed, certainly their entertainment changed dramatically. They weren't allowed to go to hospital or to theaters and you know, venues like that. So there were certainly those kind of policies, but even retail shopping is frankly a form of entertainment, you know, on some level. You're not there for just a simple transaction, you know, and if you were, you would get things on Amazon, which is, you know, where people are spending certainly a lot more time. So everything about them and their entertainment habits, their shopping habits, and even now their media consumption habits changed dramatically. And I think this presents some new opportunities for us. You know, early on, we started to reassess our clients' media buys. And if you haven't done it already, or if you're not thinking about it in the coming weeks and months, you know, give that some thought. Certainly the commuter media tactics like out-of-home billboards, certainly mall advertising, even terrestrial radio, and that combination I love of billboards and terrestrial and even streaming radio, I think is a powerful combination, you know, in particular in you know, certain markets. But that changed. You know, I wake up every morning, watch the news, I hear the traffic reports, and it's smooth sailing again this week, you know, in many of our markets. And to that point, people are consuming a lot more news and news products more than they ever were before. This is also, I think, a pinnacle moment for the news media outlets. Newspapers in general, were it not for the loss of retail advertising, would be doing incredibly well. You know, people are glued to their TV every morning. We're looking at COVID scores, like the way we did with Barry Bonds' home run scores over seasons. Okay, what's today's number? What are we up? Or we had another record. We want to know what's happening with the economy, with what's happening with the election, the social unrest in many of our communities. So we're really consuming a lot of news products. And I think that's a venue, you know, a place that, you know, certainly makes sense, not only from a public relations standpoint, but from a paid advertising standpoint. You know, if you're going to be pushing messages out, this is where consumers are spending more time on now than they were in the past. Certainly any digital campaigns that you can have, those are very quick to deploy. They don't have the lead times that printing a billboard or shooting a TV commercial might. Having those at the ready so that you can respond to the changing needs of not only your economics internally, but also your community needs, I think are essential. Email is still fabulous. Again, we're consuming a lot more, spending a lot more screen time. We're getting a lot of information on email, not only from, shopping and from brands that we like, but also I think this is an opportunity for us to inform and educate the public about what's happening. And as you know, there's a tremendous amount of value to seeing what content people are clicking on. As you send out that article or that newsletter with 5 different topics and tips, the things that people are clicking on, the things that people are engaging, I think are really, good data for you to understand what is happening in the public. What are they thinking about and caring about? And we talked about this before, adapting your search queries accordingly. I think search will still be very, very important for everyone. It's intent-based, it's very efficient, and Google really wants to connect local content with local, people. And so I think there's an opportunity for all of us there. Digital and the agility for digital, I think, is very important. And even if you can consolidate those messages and budgets, carrying not only sort of brand level message with calls to action to particular service lines, I think that will also help to meet, consumers, in those places.
Thank you. So with those digital recommendations, where does the blog fit in?
Yeah, and this is interesting. Many of us produce blogs, we produce content, and a lot of times it's designed because I have a service line or something that I want to talk about, and I want to make sure that you hear about it. But thinking beyond the blog and thinking of yourself as a content hub, again, to my point a moment ago, Google really wants to connect local people who are doing local searches with local solutions. And there's an opportunity, certainly your community will and does and should think of you as a resource for its health. Now, none of us have the depth of time to create a WebMD on our site, but I think there's opportunities to speak to what you're doing locally and educate the public to be a resource for your community in terms of what you're doing and produce by association some very good high quality content. It could be very service line specific. You have, and sorry for the acronym, subject matter experts within your organization. Sometimes just putting a simple iPhone camera in front of somebody, asking them what they think or feel about something, what should the public know about something in particular. There's a lot of forgiveness with the authenticity, and the quality of what you can produce on an iPhone is quite simple. My point being, you don't have to author a peer-reviewed article, and do a deep, study in order to produce this kind of content. You have your subject matter experts. The community wants to hear from them. In particular, even just tips on how to stay healthy at home. Long form content for patients. I think very early on, there was a shift, 20 years ago, there was a shift of consumer empowerment in healthcare. The direct-to-consumer pharmaceutical ads and WebMD, initially there was a fair amount of resistance. The physicians saying, hey, I went to med school, I don't, particularly care for you kind of printing something out and telling me that you want this particular medication. But over time, I saw people really embracing that more, and at least looking at that as a conversation starter. Well, Mr. Fahey, you printed out this article from WebMD, and why did you do that? Okay, so it looks like you're telling me that these were your symptoms. Okay, now let me tell you about you and why I'd recommend this course of treatment. And for many of us, we don't have a lot of time to create deep syndicated content, but I think there are third-party providers that you can subscribe to, or again, the subject matter experts that you can just simply, record or create some, brief content with on the website. Podcasts in particular, I'm broadcasting this from my home. It's very simple now to, convert and produce your own content. Certainly we have professional studios at Smith & Jones and over it, but also, this is something that can be produced pretty well and easily, from within your own organization. Email nurture systems, getting a sense of, okay, if I send you out this email and you click on this article, then 48 hours later, it triggers a follow-up article, that'll start to nurture people through a conversation. And at some point, encouraging them to flip over to a human or having a human reach out to them. If you've stayed with me through a few different follow-up emails on a particular topic, maybe it's time for us to have a conversation, let's send that down to our phone bank, or even having somebody within a department call to follow up on that. So, and the acronym here that you'll see in our trends report, you are what you eat, and that's a good way to remember that EAT acronym for your role and opportunity to really be, an expert in your field, an authority on what's happening, and certainly from the tone in which you're producing it, and where you're coming from, the community is going to be trusting you.
Excellent. So we talked about telemedicine. What advice do we have for the new surge in telemedicine?
Yeah, and this was something many of our rural clients were already doing. Given the physical distances, the 45-minute drive sometimes between people that were in your communities and your counties, this was something that you might have been at, doing a little bit better than the, larger, more urban institutions. The really interesting thing, I think the key takeaway here is house calls are back. You are now making house calls. The good old fashioned, small town physician with the black bag and showing up on your, front doorstep with a stethoscope and saying, Mr. Fahey, I'm here for the house call. Nice to see you. It's back. And now it's just happening in a more virtual, digital realm. What we were starting to see early on, I mean a couple of years ago, when people were starting to embrace telemedicine, it was really viewed as a transaction, and people weren't using it so much as a way to build a relationship. It was just, and in this case, we sort of dial on, we get started, we talk about what your symptoms are, and we'll talk about the treatment, and I'll call in a script, and away you go. I think there's an opportunity. You're literally inviting, somebody into your home. The physicians and nurses and the folks that are having those conversations, I think, need to keep that in mind. You're welcoming me into your home, and I think there's an opportunity there to, build those relationships, have those conversations, take a moment just to get to know somebody, to talk again, and especially if you happen to know them, their neighborhood. Point being, if your bedside manner for your institution was bad pre-COVID, it's probably going to get a lot worse. Because these technologies can tend to form us or force us into more of a transactional mode as we kind of go through. So it does have its pros and cons, but the more you can treat virtual patients like real patients, spend a minute on that small talk as you're kind of going through, and lean on that connection, those kind of connections. Advocate for training, and in particular, even perhaps following up your telemedicine with a quick survey. Can I just ask you 3 questions about your experience today, so I can learn more about, did you get everything out of it you were hoping to? Does this technology work for you? Any other advice? You can also connect a lot of your community through this, these technologies, connecting people to other resources in the community. Again, you have this opportunity to be a content hub for things like, your community's health and wellness in general. So food security and housing support, and, all of that, understanding that, hearing and seeing what's happening even within the household can kind of give you a sense of what might be triggering some of these issues, and you have an opportunity to connect them.
Excellent. So with all the bad news that our friends at the healthcare systems have to be delivering during times like this, what can we do to be more positive and more hopeful?
Yeah, and I think, this is an opportunity, I think, that, and up to this point, we've been talking about, and up to the last 6 or 7 months, I'm sure we've all been talking about just business. How do we just kind of get through this and keep doing what we're doing and weather the storm? But there's an opportunity, I think, to let our hair down a little bit from time to time, and not just sell. I think it's important that we think about how, how often, or look at the content that we're putting out there, our e-blasts, our social media, our ads, make sure that you're not just selling at every given moment. If the only time I hear from you is when you want to sell me something, eventually, I'm going to be a little bit more guarded. I'm going to be a little bit more skeptical about your reasons for wanting to connect with me. And I think there's an opportunity to just, enjoy a few moments of really humanity. We definitely need good news from time to time. You are and have that power to be a beacon of hope in your communities. And I think there's some really great content. Leanne, a publicist on our team, calls it story mining. Just listening to what's happening with employees. I mean, certainly they are frontline heroes, first responders to this crisis. But even on a personal level, they're going through other milestones, whether it's the birth of a child, or they've run a marathon, or bought their first house, or something else. There are just wonderful moments that are happening in your institution, and it's a great opportunity to kind of let your hair down a little bit from time to time. You can retell even community stories. Again, for smaller departments that don't have deep resources, there's a lot happening in your community. You can just simply hit the retweet or share button, and just kind of share good news stories that are happening. It doesn't have to be your own content, but even if your local newspaper is reporting out on something that's particularly, warm and endearing, just sharing it to say, just want to make sure you've all had a chance to see this story. Again, I think, those kind of messages go a long way to building deeper bonds. Even identifying some community partnerships for social causes, things that are happening in the neighborhoods. Just everything from the food banks and things like that are out there, just letting people know not only about the resources, but just about great moments. And part of the reason for the fun and silly dog is, just because everybody loves puppies and babies and food for some reason. So, it's that kind of content, knowing that it's that popular, even just celebrating what's happening in the cafeteria that day, can be kind of fun. The point being, and in our little inset box, you have an opportunity and you can be hopeful and empathetic, but be human. It's okay to step outside of your technologies and your robotics and your degrees, to really just kind of be yourself and shine a very human face on your organization and in particular the people within the organization. Even things like new hires, just kind of celebrating those are great news stories. People want to feel good about the person who's excited about their new job, and interviewing so-and-so about why, I'm looking forward to starting my career here, I think is and can be very important. So think about your content, make sure you're not just selling at every given opportunity, but, where can you find some of those great moments of joy that you can share with your community?
Yeah, and actually on the topic of employees, new employees, and I get asked this question a lot from a lot of the systems that we've worked with over the years, is what opportunities might there be from a recruitment and retention standpoint?
Yeah, and right now they're tremendous from a number of different points. And so this is that, seize the moment. And in particular, we're calling it seize your recruitment moment. I'm coming at this from two different points of view. Number one, as I mentioned before, this pandemic was your 9/11 moment. The world had a chance to see what you did and how you did it. This was your time to shine, and your industry has never been in a better light than it is now. And I think that's very attractive to people just in general. But in particular, going down to my third bullet point, you've also shown the public that you're working in a very essential field, that these are sustainable careers. And I think there's an opportunity to embrace that, to talk to people who might want to pivot outside of industries that were a little bit more fragile, that, had employees that, said, well, wait a minute, I enjoyed this path that I was on, but it was quickly deemed non-essential, and I want to make sure that, not only do I have a meaningful career, but I also have something that is sustainable. And I think there's an opportunity there, to take advantage of sort of those two perspectives, and make sure that you're speaking about, that as well. Even at the brand level, talking about how great your employees are. If I drove past a billboard and saw just, thank you to the heroes of XYZ hospital, real photos of real people, it's just going to remind me of the great work you're doing. Do I want to be a part of something like that that's deeply meaningful, that has an impact, and is sustainable? Now it sort of, initially we were at record unemployment levels, 16% in some communities, and we seem to have dropped down to single digits, 8-10% in some communities. But I think people are going to be looking for these kind of opportunities. So partnering, if you have a school of nursing for larger institutions, or even just partnering with schools of nursing, maybe even sharing some dollars and co-op a campaign. Let's take a page out of the retailer's playbook, and offer to say, let's do some shared information sessions. Let's, tell the community about the career opportunities that might start with that school, but then continue on. And we have internship and career placement statistics. About 98% of our graduates go on to XYZ hospital, and those kind of things I think are really helpful. Building that gratitude that I mentioned on billboards and social media just really helps to reinforce the great work that you're doing, and becomes very attractive to people outside of the industry. Many of you HR departments are embracing virtual career fairs, and even having webinars on healthcare careers, just talking to people about how to get started. Even a simple presentation on, hey, I want to get into the healthcare industry. How can I do it today? What could I start with? What's that first step to maybe a new degree or certain classes? Are there internship opportunities or other positions within healthcare that might be suitable for my skill set in accounting or operations or something? All that storytelling and even those kind of partnerships and that kind of messaging, I think, will resonate particularly well. So asking yourself, what is that employer brand? What do people think of me? I know what they might think of me clinically. I think I have a sense of how they feel about my bedside manner, but how do they feel about me as an employer? And just kind of asking yourself, why would somebody want to join? Why would somebody want to work here? Why would they want to stay here from a retention standpoint? And we've touched on some of that, here today. So.
Excellent. So we have a couple minutes left. If there's questions, comments, feedback, put them in the chat.
Yeah, again, thank you, folks. I mean, we're kind of coming to the end of this presentation. There's a full report, and we're going to send a link to everybody that registered to not only see this presentation live this morning, but for those of you that wanted to view this on demand, there's the full report of all the trends and details that we'll make available. It's on our website at smithandjones.com. But again, we'll e-blast this out with a link so that you can download that specifically. I see. Thank you.
Yes, you're welcome.
Thank you for the presentation. Appreciate the kudos and comments. While we're waiting for any final questions, we do have a follow-up. So throughout the fall, we're going to be taking a deeper dive on each of these issues in particular. And again, it was a lot to unpack this morning to kind of go through 10 of these trends, watch the clock, try to make sure that it's relevant to everyone, at the same time recognizing we've got a pretty diverse audience. But our next presentation will be at the end of this month on the 29th. And we're going to take a deeper dive on 2 of the topics, and really, a couple that I think have been on the minds of many of you. Let's get a deeper understanding of the patients and how we can reach them, not only with the messages and media, but to that last point, talking a bit about the organizational culture and recruitment opportunities, and even how those 2 might even surprisingly be somewhat related. So, and I know we're kind of coming up on the end of this. So I guess I'll just sort of pause. Thank everyone again for joining us. Just kind of talk slowly in case somebody's typing a question. But
Have a sip of your coffee.
Yeah, exactly right. But otherwise, really want to thank everybody for joining us this week. On behalf of authors of this, in particular, Lisa Barone, I think might be in the audience, but really played a key role in developing this trends report. So thank you, Lisa, for your time and talents helping to bring this together and make it possible. So again, thank you, everybody, for joining us this morning. Hope this has been helpful.
Hope you enjoyed it.
Thank you for the good work you're doing. Keep it up.
Absolutely.
All right.
Thank you, Paul. Nice job. Very timely. You gave people 10 minutes back in their day.
Exactly. Enjoy the gift of free time, everyone. Have a great morning.
Have a good day. Bye.